This was a very important presentation because Hispanics are now the largest minority in the United States. And also, you know, we have 25 countries in Latin America that have Hispanic population, so more than 300 million people. And there are a lot of cancer disparities that affect them. Particularly, we are now talking about lung cancer. For example, there is disparities in the lung cancer diagnosis. The molecular testing that is so crucial is done in Hispanics in a frequency much lower than the white population in the United States. And that also happens in Latin America. But you can always say in Latin America, yes, but in Latin America they have other social determinants of health that affect them tremendously, like no insurance or lack of access to technology. But it's also surprising that in the United States we have also the same problem. There are also disparities in immunotherapy. You know, immunotherapy is so common now in lung cancer, and there are disparities in the outcome. And with several Latin American friends, we have been doing several studies to see the outcomes of patients with lung cancer and immunotherapy. And apparently, we have a little bit unaged or a little bit better results when we give immunotherapy to Hispanics compared with whites. And the other interesting thing that we have also discovered with many friends in Latin America is that now everybody knows that the frequency of EGFR mutations, the most popular genetic aberration, is much higher in Latin America. No? In the United States, it goes from 12 to 15%. In Latin America, for example, in Mexico, it's 25%. In Colombia, it's close to 30%. In Peru, my country, is 40%. That means that these patients have an edge, an advantage, because they will have probably a better survival than the patients that don't have the genetic aberration. Unfortunately, all of these biological advantages get erased when the patients don't have access to molecular testing or the patients don't have access to the drugs. And that, as I said, not only happens in Latin America, but also happens in the United States. This was the presentation that we did.